Hi all. In this class, we are going to discuss the few equipments related to neurological department. Okay, so when we ask neurological related equipment means the first thing which comes to in our mind is EEG, right? So that is the topic we are going to discuss throughout today class. That is EEG. The abbreviation of EEG is electroencephalograph. Okay, so as I told already, there is a three technical terms we used to get confused. That is electrocardiograph, graphy, and gram. So irrespective of any kind of electrical activity, whether it is ECG, that is a heart, ECG, or EEG, EMG, ERG, UOG, EGG, whatever it is, when the word ends with the graph, it's an instrument. Okay, when the word ends with graphy, it's a technique, and when the word ends with gram, that is electrogram or encephalogram, then it is meant for the output or result which you get from the machine. Okay, so this should be very clear when we are speaking about these terms. Okay, so first we will see in today class the basic things of EEG. So EEG is the electroencephalograph. So this is the one technique which is where we study electrical activity of the brain. Okay, so here the electrical activity is nothing but it's the action potentials whenever the brain cell, here the brain cell is the neuron. So whenever the brain cell is being excited, there you will be having some action potential being generated. The capturing of that action potential is nothing but is the EEG. Okay, so here the output what you get from EEG is the what electroencephalogram. So that electroencephalogram, it's usually it represent like it's a normal waveform at different frequency. So these waveforms are nothing but it's a summation of action potential which is being generated by the brain. Okay, so in EEG we are using with help of electrodes, we are capturing that action potential due to some kind of any response which is being generated inside the brain, that we will be tapping by means of electrodes. Okay, so the with help of other electronics circuits and some components, after capturing this has to be do some filtration and signal processing, signal conditioning, then we will be showcasing that means we will be displaying that waveform in display. Okay, so this is the overall process of how does the EEG machine is working. Okay, so this brain waves, if you see the electrical activity of brain waves, usually it's found in 10 millivolt when you are placing the electrodes just over the surface of the brain. Whereas if you are placing over the surface of the skull, then the voltage what you get from brain is that 1 to 100 mu volt. So the variation of this potential, okay, the variation of this output is because of the placement where your electrode is placed. Okay, the reason is that if the electrode is the component is going to pick up your brain activity, right? So if you are placing the electrode directly to the brain, if you are making direct contact with the brain in order to acquire the signal, there the signal you will be getting very quality signal, that is a strong signal, so that the weightage of that output is in higher range, that is 10 millivolt, because you have been contact directly with the brain. Okay, so there is no skull or skin to resist the signal. So whatever signal is being generated by the brain, it is almost to through close to 90 percentage you are getting that good quality signal, good strong signal. Whereas if you are placing the electrodes just over the surface of the skull, okay, that is over the head, then in that case there is a less possibility to get good quality of signal. The reason is that you have a skull and you have a skin over or on top of the skull, and then so many artifacts will be there. So after crossing these many stage, only you will be having chance to capture that signal. So in that case you will have very low quality at the other end, so that the weightage, if you see the weightage of the brain waves activity is 1 to 100 mu volt. So this is the variation based on the position or the placement where you are placing the electrodes. Okay, so based on this position there is a two types, as you know. There is one is invasive type, another one is non-invasive type. So invasive type means you will be placing the electrodes directly over the brain. Non-invasive means just over the skull. Okay, you no need to do any cut or opening the skull or something. So this is the two main methods. You can go with EEG recordings. So based on the application, demand arised by the patient, doctors or physicians, or it's or based on the condition of the patient, or we can go with either type of invasive type or non-invasive type. Okay, so let's we will see the origin of EEG. Okay, so far we discussed what is EEG in the basic things. So next we will see origin of EEG, how this EEG signal is being generated, what is actually is called electrical activity of the brain, everything in detail in next class. Thank you.